Switching gears here, May is Stroke Awareness Month, and today's leading edge treatment for strokes isn't just about reacting, it's actually reversing a stroke. And Dr. Coleman Martin, interventional neurologist for St. Luke's Health System, is here to explain. And thank you much for being here today. And we're going to take a look at some of the things that you guys have been using in procedures right now for people. But first, let's talk about what a stroke is and who is at risk.
Anyone's at risk for a stroke. A stroke is an interruption in brain function from typically a blood artery. So when the blood flow stops to one side of the brain, it typically causes a person to become weak or lose their speech. Strokes occur usually without any warning at all.
I'll tell you a story. One of my friends last week, she was in Branson with her grandma, and they were just driving along. All of a sudden, her grandma's speech started to get slurred, and she thought, something is wrong, something is wrong. Luckily, she was close to Warrensburg, and she knew the sign of a stroke, pulled over, and indeed, her grandma was in a stroke. I mean, it can come on so quick like that.
It's so important to know the stroke. We use the acronym FAST to educate people. So a sudden weakness on one side of the face, inability to lift or maintain one of the arms against gravity, the speech being suddenly slurred or unintelligible, and then T for time. That time is so important. For every minute that a stroke is ongoing, the brain loses for every second the brain loses 32,000 brain cells. For every minute, the brain loses 7.5 miles of myelinated nerve fiber. And if we can't get that turned around quickly, the patient simply can't recover.
And of course, you should dial 911 if you are feeling those symptoms. And if you're watching us this morning and you're feeling that, of course, definitely want to do that. Well, we've come so far in terms of stroke treatment. What are the current leading edge treatments that St. Luke's is actually using to reverse a stroke?
For very small clots in the brain arteries, we can give an injection of a clot-busting medicine, TPA. It will sometimes break down the blood clot and restore flow. But when that medication doesn't work or the clot's too large, we typically use what's called a stent retriever device. This is
this is actual retrievers.
Right. We go into the arteries down at the groin, and then we deploy this tiny device inside a brain artery.
Okay, I'm gonna put a piece of paper behind you so people can, because this is really amazing. Just what happens here. I mean, it looks like just a regular wire, and then
it's out of the catheter, wraps itself around a blood clot, and then we can pull the blood clot out of the body.
It's just amazing. That is absolutely amazing. You guys, you are a pioneer in the use of this stent retriever device.
We were involved with the early clinical trials, and then once the devices became approved, we were one of the first centers in the Midwest to offer this. And we do this treatment frequently.
Okay, tell us what you have here.
For arteries that are larger, say a blocked carotid artery, we'll sometimes place a stent. And these are again put in from the groin, and they open up inside the artery, and then with a little bit of body heat, they then actually expand and restore the artery to its normal size.
Wow. Congratulations on the success of the procedure. I mean, this is amazing how much technology and how much science has advanced as the years have gone by. St. Luke's is a comprehensive stroke center nationally recognized to treat any stroke. And for more information, all you have to do is go to this website, stlukeskc.org/stroke, and you can take a free online risk assessment to see if you are at risk for stroke. And like Dr. Martin was saying, don't wait, act fast. Thank you so much for being here today.
Thank you.
A lot.